Let me ask you a question. What if the very rules we follow to be healthy are actually the things making us sick? We're going to dig into that really provocative idea, which is based on the manuscript Dinner with God.
I mean, here's the central paradox we're all facing, right? We have more nutritional science, more data, more guidelines than at any point in human history. And yet, if you look around, our collective health seems to be going in the completely wrong direction. So what is going on?
Well, the signs are pretty much everywhere. Chronic diseases are just exploding. Conditions that were once only seen in adults are now showing up in kids. And if you've ever felt totally lost by diet advice that seems to flip-flop every other week, you are so not alone. It's a symptom of a much, much bigger problem.
Look, we've been trying so hard to follow the map we were given, right? We count our calories, we track our nutrients, we follow all the rules. But what if the problem isn't that we're bad at following the map? What if the map itself is just wrong? That's the core question we're tackling here.
So this brings us to the first big reason why our map might be wrong. And it's that sometimes the things we think we know for sure are the very things that blind us to the truth that's staring us right in the face.
This quote from H.L. Mencken, man, it just perfectly captures that intense frustration you feel when you know an entire system is broken. And back in the 19th century, there was one doctor who felt this so deeply, it literally cost him everything.
Let me tell you about Dr. Ignaz Semmelweis. It's 1847, and he's horrified by the number of women dying in his maternity clinic. He notices a simple pattern. Doctors go from the autopsy room straight to the delivery ward. So he has this hypothesis, and he makes them start washing their hands. The result? It was nothing short of a miracle. The death rate dropped by 85%. But did his colleagues celebrate him? No, they fired him. They mocked him because his discovery went against their accepted theory of bad air. The tragedy is he ended up dying from the very same kind of infection he worked so hard to prevent.
You see, Semmelweis's colleagues were trapped by the dominant logic of their time. They just couldn't accept this powerful new evidence because it completely shattered what they believed to be true. And, as we're about to see, our modern world of nutrition is absolutely filled with its own version of bad air. So let's take that idea of dominant logic and apply it to our first big piece of nutritional dogma, the calorie. I mean, this one number has pretty much defined how we think about food for more than 100 years.
Just think about it for a second. When you think about a meal, a real meal, you think about flavor and culture, memory, community, nourishment. So how on earth did all of that incredible human experience get squashed down into a single sterile number?
I mean, just look at this bowl of pho. That's not just soup. That is an epic poem in a bowl. It's the story of a culture, it's a family recipe, it's the result of hours, maybe even days of care and attention. It's a whole experience. And then our modern system takes that entire beautiful edible epic and reduces it to this, 425. A piece of data that's been completely stripped of its meaning, its story, its soul.
And the origin story of the calorie, well, it tells you everything you need to know. It wasn't born from biology or medicine. No, it was invented to measure how efficient steam engines were. It was a guy named Wilbur Atwater who decided to apply this mechanical idea to the human body, basically treating us like we're just furnaces. And by 1980, this energy in, energy out model wasn't just some theory, it became official government policy. This is where the logic just completely falls apart. An apple is this incredible, complex system of information for your body. But in a world where the only thing that matters is fewer calories, a bottle of chemicals with 0 calories gets an A+. The logic is totally broken.
Okay, so the calorie is a flawed map. We get it. But what about the more, scientific approach of just focusing on the individual nutrients? Well, as we're about to see, this is really just another dead-end road on that same wrong map.
This brings us to the idea of nutritionism. It's this belief that a food is nothing more than the sum of its parts. If you can just tally up the grams of protein, fat, and carbs, and the milligrams of vitamins, then you know everything you need to know. And on the surface, this seems kind of manageable, right? Our health agencies track about 150 different nutrients to create all the dietary guidelines. It feels precise, it feels scientific. But here's the reality check. Scientists have already identified over 140,000 different biochemical compounds in the foods we eat. So that 150 we're tracking, we're not even scratching the surface. And this
This is the absolute knockout punch. When you actually try to calculate the possible combinations of all these compounds, you'll get a number that is so ridiculously vast it's bigger than the information capacity of the entire observable universe. So the idea that we can manage our health by tweaking this tiny list is, mathematically speaking, just cosmic folly.
And the result of this flawed model is exactly the kind of whiplash we've all experienced. First, fat was the enemy, now it's good for us. Cholesterol was going to kill us, now not so much. Carbs were the foundation of everything, and now, for a lot of people, they're the villain. This constant flip-flopping, that's not science just getting smarter, it's the sign of a fundamentally broken model.
So here's the really crucial point. The problem isn't just the calorie or the nutrient. The problem is the entire philosophy of breaking things down into their smallest little parts and assuming that that tells you the whole story. This is the philosophy of reductionism. A perfect example of this came from the Human Genome Project. Scientists went in expecting to find over 100,000 genes. A simple blueprint where one gene equals one disease. What they found instead was that humans have about as many genes as a common weed. The real secret wasn't in the number of parts, but in the incredibly complex network of relationships between them. So reductionism is like studying a single tree in total isolation. And you can learn a lot. You can learn about its bark, its leaves, its wood. You can analyze its chemistry down to the very last molecule. But systems thinking, that's what ecologists are showing us now. A tree isn't an island. It's part of this vast underground network, this wood wide web where trees actually communicate, they share resources, they warn each other about danger, they work together as a collective. And this brings us to a really profound truth. A tree is not a forest. The real meaning, the resilience, the life of the whole system, it's found in the connections, not just in the individual pieces. And this is just as true for our food as it is for a forest. So, if the old map is totally wrong, what's the new one? Well, the framework that's proposed is that we need to stop thinking of food as fuel and start thinking of it as information. Food speaks a language that our bodies have evolved over millennia to understand. And this language has three key parts. First, there's structure. The physical way a food is put together really matters. Just think about an apple versus applesauce versus apple juice. Same source, totally different information. Second, timing. The rhythms of our meals send incredibly powerful signals to our biology. And third, context. The culture, the company we keep, the story behind the meal, it all changes how our bodies receive the information on our plate. And that leaves us with one last provocative thought to chew on. Instead of asking how many calories are in this meal, maybe we should be asking a totally different question. What is this food trying to tell my body?